Your body at 65, 75, or 85 carries the same fundamental intelligence that once grew you from a single cell into a complete human being. But society, Dr. Vic Naumov writes, has programmed you to believe otherwise, that aging simply means decline. He calls this belief a destructive myth, and he spent this chapter dismantling it. Welcome back to You Are the Medicine, the audiobook by Dr. Vic Naumov. Copyright 2025. All rights reserved. This is episode 9. Today we're talking about aging gracefully and reclaiming vitality in what Dr. Naumov calls your golden years. Hit like, drop a comment, and let us know where you're tuning in from, and share this with someone who needs to hear it. Subscribe and turn on that notification bell. We're just getting started. Let's begin. Now, let's step into aging gracefully. Dr. Naumov opens this chapter with a direct challenge to what most people believe about growing older. Your spine and nervous system, he writes, do not have expiration dates, and when these systems maintain optimal function, your body can demonstrate remarkable capacity for healing, adaptation, and vitality that exceeds much younger people who've neglected their structural health. The medical system, he argues, treats aging as a disease process requiring increasing pharmaceutical management, overlooking, in his view, the reality that most age-related problems result from accumulated structural dysfunction that can be addressed at any age. You are the medicine, he writes, and your mature body contains sophisticated systems that can create extraordinary health and vitality when structural interference is removed. End quote. Dr. Naumov. Dr. Naumov opens with what he calls the aging myth, the belief that decline is simply inevitable. This myth, he argues, begins with language itself. Phrases like over the hill and senior moments that create expectations of diminished capacity while ignoring that wisdom, emotional regulation, and spiritual awareness often peak during later years. Medical training, he writes, reinforces this myth by teaching providers to view older patients as collections of chronic disease requiring ongoing management, rather than individuals with real potential for improvement. And older adults, he notes, are prescribed an average of 5 different medications, creating complex interactions that Dr. Naumov argues often cause as many problems as they solve. Family and friends, he adds, often reinforce the myth too, with well-meaning advice to slow down and take it easy that can actually encourage the sedentary lifestyle that accelerates decline. Dr. Naumov points to something worth sitting with. Chronological age, he writes, is a poor predictor of health outcomes. Some people maintain excellent vitality into their 90s, while others decline significantly in their 60s. The difference, he argues, lies less in genetics and more in lifestyle choices and structural health. He points to populations with unusually high numbers of centenarians, noting they tend to share active lifestyles, strong social connection, and a sense of purpose. The most empowering part of rejecting this myth, Dr. Naumov writes, is recognizing it's never too late to begin. Your body, he argues, responds to positive change at any age because the intelligence that built it continues operating throughout your life. Dr. Naumov's next section draws a sharp line between natural aging and what he calls pathological spinal degeneration. Natural aging of the spine, he writes, involves gradual changes in tissue composition that occur slowly, without necessarily creating pain or disability when alignment is maintained. Pathological degeneration, by contrast, he argues, involves rapid breakdown driven by mechanical stress and nervous system dysfunction, the kind that creates real pain and disability. The critical difference, he writes, lies in whether the spine maintains proper alignment throughout the aging process. Disc degeneration, arthritis, and eventually spinal stenosis, he argues, follow predictable patterns tied to alignment and movement quality, rather than simply being inevitable with age. Dr. Naumov extends this argument to bone density, muscle mass, and strength, suggesting that seniors with optimal spinal health sometimes outperform much younger people whose nervous system function is compromised, since strength depends heavily on nerve signal quality, not just muscle size. Even advanced degeneration, he writes, can often be improved through approaches that support the body's remaining functional capacity and repair mechanisms, meaning, in his view, it's rarely too late to see meaningful improvement. Dr. Naumov then turns to a topic with real, serious stakes for older adults: balance and fall prevention. Balance problems and fall risk, he argues, increase with age, not simply from inevitable neurological decline, but because accumulated spinal misalignment can interfere with the nervous system pathways that coordinate balance and protective responses. The upper cervical spine, he explains, plays a particularly important role here, housing pathways connecting your inner ear balance organs to your brain. Proprioception, your body's sense of position and movement, he writes, depends on clear transmission through spinal pathways. Reaction time and the protective responses that catch you before a fall depend on the same clear signal transmission. And muscle strength for balance, he argues again, depends more on nerve signal quality than muscle size alone. Dr. Naumov also raises medication as a factor in fall risk, and this is worth pausing on directly because it's genuinely important. He's right that this is a real, well-documented concern in geriatric medicine. Older adults on multiple medications do face a measurably higher fall risk from drug interactions and side effects like dizziness or reduced reaction time. Where extra care matters is in how that gets addressed. Medication review and any changes to a senior's prescriptions should always go through their physician, who can weigh each medication's benefit against its risk. That physician-led review is standard best practice in fall prevention medicine, and it's the safest way to act on exactly the concern Dr. Naumov is raising. Fear of falling, he adds, can create its own problem: muscle tension and reduced activity that further compromise balance in a cycle that addressing the underlying structural issue can help break. The comprehensive approach to fall prevention, Dr. Naumov writes, includes spinal care alongside a physician-guided medication review, good nutrition, environmental safety improvements, and appropriate exercise. A combination, he argues, that produces better results than any single approach alone. In the final section, Dr. Naumov turns to what he calls staying active and engaged, making the case that structural health and quality of life in your later years are deeply connected. Energy levels, he writes, depend heavily on nervous system efficiency, since your brain must coordinate increasingly complex processes as your body ages. Physical activity capacity, he argues, correlates more strongly with nervous system function than with muscle mass or cardiovascular fitness alone. And cognitive function, he suggests, connects to spinal health through blood flow and nerve signal clarity. Social engagement, he writes, becomes easier to sustain when pain, fatigue, and reduced mobility aren't creating barriers to participation. Learning new skills, creative expression, volunteer work, travel, grandparenting, spiritual growth. Dr. Naumov frames all of these as more accessible when structural health supports the energy and clarity they require. The through line of this section, he argues, is that declining engagement isn't an inevitable feature of aging. It's often a consequence of treatable structural problems that, once addressed, open the door back up to full participation in life. Dr. Naumov closes this chapter with a recap and a set of action steps. The aging myth, he reminds you, steals your power to experience real vitality in your later years by convincing you dysfunction is simply normal. Balance problems and fall risk connect closely to spinal health and, importantly, to medication management best handled by your doctor. And the difference between natural aging and pathological degeneration comes down largely to whether your spine maintains proper alignment and function over time. He offers several action steps you can begin today. First, schedule a comprehensive spinal assessment with a chiropractor experienced in senior care. Second, reject the aging myth deliberately. Surround yourself with people who support your potential for continued vitality rather than reinforcing limiting beliefs about decline. Third, build daily balance enhancement activities into your routine, alongside environmental changes at home that reduce fall risk. Fourth, schedule a full medication review with your physician, especially if you're taking multiple prescriptions, so any adjustments happen safely and under proper medical guidance. Fifth, create a comprehensive activity plan built around things you genuinely enjoy, while gradually expanding into new challenges that support continued growth. Sixth, optimize your nutrition around anti-inflammatory foods, adequate protein, and essential fats that support both nervous system and brain health. And seventh, establish consistent sleep practices and track your progress using real functional measures: energy, activity capacity, balance confidence, and cognitive clarity, rather than just the absence of symptoms. Remember, Dr. Naumov writes that you are the medicine, and your mature body contains sophisticated healing systems that can create extraordinary health and vitality throughout your golden years, when structural interference is removed and optimal conditions are maintained. That's episode 9 of You Are the Medicine. If this episode changed how you think about aging, do 3 things right now. Hit like, drop a comment, and tell us which action step you're starting with. And share this with someone who needs to hear it. Subscribe to the channel and turn on that notification bell. Episode 10 is coming next. Until then, remember who you are. You are not fading. You are not broken. You are the medicine. We'll see you in the next episode.